This morning, we also focus on the medical challenges affecting women during the pandemic. Here's Betty Thompson-Moss.
This has been an undescribable experience.
That is how Dr. Inga Pratt, obstetrician and gynecologist, is reflecting on the pandemic and how Bahamian women had to maneuver, especially during delivery.
One of the biggest changes was no visitation at hospitals. Women now have to labor without partners, and that has been a big adjustment. But I saw so much strength. Bahamian women stepped up. They just embraced the experience, and they welcomed the next generation who will have to deal with the ramifications of COVID-19, I think, even more than us.
Dr. Pratt shared in deliveries, describing the new norm and requirements with safety as a paramount feature.
Now, when a woman is pregnant, especially if they're having a cesarean section, routinely we perform a COVID-19 PCR test on them. Now, if the COVID-19 PCR test is positive, then we have to take full precautions. So before, when patients were in labor, we were able to have a lot of interaction, physician to patient, staff to patient, family members. A lot of times, a lot of family members would be present. That process was changed where only essential staff was in the room with the laboring patient, and we had to wear complete COVID-19 protocol. So from the complete body suit to the boots to the cap, facial covering. So we were covered from head to toe. For the COVID positive moms, they'd actually have their babies one-on-one. So they spent the entire time with their babies, so they weren't removed to the nursery or anything like that. So I think that actually improved the mother-child connection. So that was actually a positive that came out of that, the roaming in with the mother.
Now, outside of the delivery room, there has also been a delay in general health screening for Bahamian women, resulting in new health issues surfacing.
I'm seeing an increased occurrence of pre-cancerous lesions, particularly of the cervix. We have identifying a lot more breast masses that have to be investigated. So I think we were in emergency mode, and we have to transition now from that emergency mode to screening, primary care, and try and adjust to the new normal. So it's important for us to continue to do our breast self-exam, our mammograms, pap smears, colonoscopies. And because of the pandemic, those things weren't being done. But I'm also seeing a lot of abnormalities of the cervix, which are usually picked up with a pap smear. So a way to combat that is with the HPV vaccine that the government has available, and it's available for any Bahamian woman who'd like to get it, who's over the age of 90. Usually we recommend from the age 9 to age 40, but anyone can get it. It's available at NHI clinics, and most of the gynecologist offices give the vaccine. And the government has an initiative where our adolescents are routinely given the vaccine. So in countries where the vaccine has been given for over 15 years, they don't see cervical cancer anymore in their intrinsic population. So essentially, if everyone becomes vaccinated, we won't see cervical cancer in the next 20 years.
Despite this light at the tunnel for cervical cancer, a significant number of Bahamian women are still showing symptoms of non-communicable diseases like diabetes and hypertension due to their lifestyles and diet. For the morning edition, I'm Betty Thompson-Moss.